So I'm Scott Rogers. I'm currently 1 month into a new job as the Associate Dean of Clinical Education at OUHCOM. And so, like everybody else, I'll kind of rewind and tell you how I got there. Grew up in a small town outside of Amish country in northeast central Ohio, one stoplight town. Spent my whole childhood actually trying to get out of that town because I thought I needed to spread my wings and get to the big city and be this like phenomenal person. Like I was stifled by all these people around me, and I wasn't one of them. And lo and behold, I came to Columbus for medical school at Ohio State and quickly realized I was a fish out of water. Maybe in a good way, though, right? I realized that there were a whole lot of perspectives that I didn't know and recognize. In particular, coming from a very homogenous racial and ethnicity cohort in rural Ohio, coming to Columbus was a melting pot of culture for me. And so that was really, really valuable and a great experience. But I sort of thought back to my childhood when I went through medical school and thought back to the only kind of mentor I had from a physician standpoint, and that was my own family doctor. And she was pretty incredible. Her name was Dr. Betty. Well, that was her first name, but everybody called her Dr. Betty. And she was practicing out of her house. And she was probably in her 70s when I was a child. And you'd go sit in her waiting room, which was her living room. And she'd take you back. And she still had like plates with like agar, and she had penicillin that she'd give you in your butt right there. She was old school, right? And she retired and nobody took her place. And so I was like, talking about small town newspapers, like the small town newspaper, when I got into Ohio State, interviewed me at the like little diner in town with Dr. Betty, who at that time was like nearing 90. I mean, she was in her upper 80s. She had stopped practicing. And they had this whole story about how like I was being groomed to take her place. I don't know about that. But I did kind of buy into this kind of rural dream, even though I'd escaped the rural setting. I was like, well, maybe like going back to a small community sounds kind of great. And so I started kind of exploring that in early medical school, and everybody looked at me like I had two heads, right? And I don't mean to disparage my wonderful colleagues at Ohio State. I don't know if we have any Ohio State students here. They're wonderful, but I will tell you, like, they looked at me like I had two heads when I said, I want to be a rural family physician, right? Like, what? You want to be a family doctor and you want to be rural? Like, something's clearly wrong with you. And so it took me a little while, but eventually I found this incredible resource in Randy, who was at OSU at the time running the rural residency there in Bellefontaine. And then wonderful other mentors like Linda Stone, who is an incredible family physician, really exploring humanism in medicine and many of the things that I needed desperately. And so I found my tribe, and that Rural Health Scholars was an important part of that. I met Eric there, I met Lars there. Lars and I went to the NHRA conference in Anchorage, Alaska, and he like almost killed us in Denali National Park. Like
no trail, you just go
right. Like we come back at 3. If you're not on the bus at the stop, like you're staying overnight with the bears and whatever. My wife was like, "What have we gotten into?" Well, anyway, I so found my people, found my tribe. I was like, this is it. I'm gonna be a rural family doctor. But I wanted adventure. I really, much like I wanted to get out of my hometown, I was like, well, I want to try something new. And so I went to the AAFP National Conference and, got to walk through this huge expo hall and find all these incredible programs all throughout the country. And I just like landed on this incredibly quirky program director who couldn't stand still and was like all over the place, and just sold me on this tiny little community in Southern Oregon And so I matched to a program in Oregon Health and Sciences rural residency in Klamath Falls, where Kara went, I believe, right? And had a wonderful experience there and said, okay, I'm ready. I'm going to be a rural country doctor. Where should I go? My wife is a veterinarian. She very begrudgingly agreed to this adventure. She's a home buddy. She wanted to stay in Ohio, but she said, oh yeah, I'll come along for 3 years. We'll try it. We had our first child at the end of residency. And so she's like, let's go a little closer to home. But like, we do love the mountains. We love the rural lifestyle. And while we can find that in Ohio, let's keep this adventure going. So I found a tiny little job in this community in Western North Carolina, outside of Asheville. Beautiful part of the country, incredibly impoverished rural Appalachia. We had no cell phone service. We had a 25-bed critical access hospital, rocking chairs on the front porch of the clinic, a little babbling brook in the front. There was an intentional community of like original Quakers, but they're really just like hippies that lived there. And so we served them, and then the Baptists, the like hardworking, salt of the earth Southern Baptist community there. And it was my dream job. I was like, this is it. I have ascended to everything that Randy Longacre. I'm here. I'm in it for life. I'm committed. I'm going to do it. So I got to do, inpatient, outpatient, OB, nursing home, ER shifts, sports med, you name it. I became the hospice medical director for the county. So on my days off from seeing patients, I would do hospice home visits. Many of these patients had no running water, no electricity, incredibly proud mountain people trying to die with dignity at home. And wow, they invited me to be a part of that. Wow. So fast forward 3 whole months of practice, and I get a phone call from UNC Chapel Hill, and they say, will you take our medical students to rotate with you? And I was like, what do I know about teaching? Like, how'd you get my phone number? I am 4 hours away from Chapel Hill. Like, I'm up in the mountains. Well, yeah. Good question. I actually had, the pagers didn't work either. So when I was en route from my home had cell phone service. I was half hour from the clinic, which didn't. And then the hospital had cell phone service. So if I was en route from my home to the office or my office to the hospital, it was a dead zone. So I just had to wait. A nurse would call and say, your patient's like 8 centimeters. And I'd say, all right, I'll be there in half an hour. Don't give me any updates because I won't know until I get there. Anyway, so I reluctantly said yes. I said, all right, I'll take a student. I thought, unlike Kara here, like, I was like, I don't think I'll be good at teaching. I don't think this is for me. Like, it's gonna be great. But I honestly thought they'll send me a student, it'll be a disaster, and they'll never send me another, and it'll be fine. But they sent me the student, and there's nowhere for these students to stay, so they live with me for a month at a time. That was terrifying, right? I had a brand new baby. Like, they became totally immersed in my life. They'd go with me to nursing home. They'd go with me to the office, deliveries. They'd go with me to board. They asked me to be a board member. I don't know if we've talked about this yet, but when you're in a rural community and you're a physician, they ask you to like lead these things that you have no business leading. So I became a board member of the Therapeutic Equestrian Center. But because they would bring in kids with developmental disabilities and like, put them on horses, and it was magic. They did great work, but I know nothing. So I would drag these students with me. All right, and I fell in love with teaching. I just loved it. These students would keep me on my toes. They'd keep me learning new things. I was petrified that I was going to become this like country bumpkin doctor that lost relevance because I had no connection to, learning and lifelong learning. And that's not true. And I'll tell you, as lifelong learners, like, you learn the skills to acquire new knowledge. But these students were an easy in because, boy, they'd come and I'd be like, well, what are you doing in Chapel Hill? Oh, yeah, me too. I mean, medical students who taught me about GLP-1s, I was like, oh, I know what those are. Anyway, okay, so fast forward 5 years of practice in my dream job. My wife is pregnant with her third child, and we woke up one day and looked around and said something needs to change. We are in the middle of nowhere, raising a family. We have no access to our own family. It's time for a change. And I will tell you, it's one of the hardest decisions I ever made in my life. Professionally, I was devastated. I thought, I am giving up a dream job to move home to Ohio. I am abandoning my patients. They have still not replaced me, and I've been gone now. Gosh, I can't do the math. 7 years. And so I thought this community really needs rural docs, and I'm making the choice to put my tail between my legs and come home to Ohio. And we made the decision to move closer to an urban center, to be closer to family. And so I went through all those stages: anger, denial, bargaining. Like, how am I going to possibly be fulfilled in Columbus, Ohio, when I had this dream job? Like, nothing will ever compare to this. And so finally I reconciled and said, okay, I can be happy. Just got to figure out what I need. What do I need? Number one, the underserved, right? Rural communities inherently are underserved. And that definition is really interesting, because what does that really mean? But the reality is, in an urban setting, you can find underserved just as easily. The parallels are incredibly similar, right? So access to care in a rural setting is challenging because of the geography. You know, for me, it was a mountain pass. Like, I couldn't get my patients to an HIV specialist. I had 2 patients with HIV in this tiny community. They couldn't make it all the way down for an HIV follow-up. So you had to like call them up and learn how to do a lot of it on your own, and get the specialist support over the phone, and they were phenomenal. Well, in an urban setting, right, you can have an infectious disease doctor on every block, but access to care is still a challenge because of structural racism and social determinants of health and many, many other things you all know about. So one was underserved. The second piece was teaching. I had fallen in love with teaching. I knew whatever I did, I needed to be in an environment where people were keeping me on my toes. I was able to kind of engage with learners. And so I knew I wanted to take the leap and maybe make teaching a bigger part of my career. And then the last piece is, what is it about rural family medicine that's so special to me? And I realized maybe deep down, it wasn't the rural piece as much for me. It was that scope of care, that full spectrum mentality was really important. And so I said, where in like Columbus, Ohio, can I still deliver babies and still take care of grandma in the ICU and still, you know, do home visits? And I thought back to medical school, and I'd rotated around all the hospitals, and so I found a home. Grant Hospital in downtown Columbus is a very full spectrum program that really embraces and empowers family physicians to be fairly full spectrum in their scope. And so it kind of was a great match for me. So I took the leap into medical education. My dream job changed, it morphed. And I was there for the last 6.5 years. And I had the opportunity to, like some of these folks, morph my patient care and give up some of the like direct patient care to precepting residents. And right, as much as I love putting my hands on and delivering those babies, I maybe stood there and helped, you know, coach a mom while, you know, helping a resident be the ones that get to keep their hands on, or a student. And so that kind of morphed and was pretty special. About 3 years into that job, I ascended into the associate program director role, which means I did even less clinical care and a little bit more administrative stuff and planning curricula and helping recruit and build the next workforce of family physicians. And then most recently, I was on spring break, and you know, it's COVID, so we like rented a house with our best friends from college, and we just like sat there the whole week. And so we had a lot of time to talk, and one of my best friends from college is a school psychologist, we were just up really late one night talking about like our professional aspirations and dreams and goals, and something just clicked in me, and I said, like, oh, it's not that I'm unhappy, but like, what's my next step? Like, I thought I was going to be in this job, this new dream job forever, but is there something else that I should be doing? And the very next week I got home and this job posted for this dean position at an osteopathic medical school. I'm an allopath. And I just said, gosh, what a cool opportunity to help shape the curricula and help shape the opportunities for medical students to train in an environment. And I had worked with OU-HCOM students throughout the years at my grant hospital and residency. We took them a lot, and I always appreciated them. And, you know, I went onto the website and read through the mission and vision, and I was like, wow, these people are unapologetically primary care generalist focused. They say right there in their mission statement, they want to train like family physicians, or at a minimum, generalist trained specialists, people who appreciate that general medicine approach. And so that got me pretty excited. And then I was like, well, you know, I'm an MD. They don't want me. Like, but then I realized, gosh, you know, in that time, Randy had transitioned and had already broken that glass ceiling for me. MD dean at a DO school. So, like, he can do it. Gosh, maybe I can figure this out. And so I took the leap and applied, and here I am. And so I don't know what I'm doing. I'm an imposter. I'm a month into the job, but it is. And I went through again a whole nother mourning process as I gave up my last delivery. Well, never say never, but my last delivery for now was on Labor Day. Ironic, you know. And you know, my last inpatient call weekend was that weekend as well, and I had to say goodbye to my patients. And so now I'm still precepting residents a half day a week, so I have a tiny connection to clinical care. My vestige of being a real doctor is still there, but I wear a suit and I like sit in on a lot of meetings, and I look around going, oh my gosh, like I can be involved in making some really big decisions, and that's pretty exciting. It has its drawbacks, but I'm excited. I talked more than I should have. I think I'll end it there. I think the most important thing to share with y'all is it's okay if your dream job changes. I think many of you are sitting in shoes that many of us have all sat in, and you think you have to carve this path to this job or this profession that has to look a certain way. And I guess that's the whole point of this session alone, is that it doesn't have to look any way, and it can change and it can morph. And you can do it for your professional satisfaction. You can do it for your family. You can do it for both. Don't settle.